Let us continue the discussion on fungi. In lecture 1 on fungi, we have discussed general features of fungi, structure, classification, and other informations about fungi. And in this lecture 2 on fungi, we are going to discuss about the pathogenicity, infections caused by fungi. Let us discuss about mycosis. Mycosis means infections caused by fungus. So there are many different types of fungi. They cause infections among human beings and all other domestic animals and all. So these infections collectively known as a mucosis. So mucosis means singular, mucosis means plural. So the infections may be caused among humans and domestic animals both. So they may cause uh, infections of some of the tissues superficially, or they may cause infections into subcutaneous tissues, or they may cause systemic diseases. So the subcutaneous infections, they extend from the tissues, and sometimes they are spreading to the adjacent structures such as bone, organs, body organs like any other liver, pancreas, or any other organs. So the systemic infections, they are very rare, but often they are very chronic. So the human fungus infections, they are broadly classified into two types, especially superficial infections and deep seated infections. Superficial infections and deep seated infections. Deep seated infections means systemic infections all over the body. The infection enters into the all body system. So superficial means some skin infections in the hand or leg or somewhere. It is benign. It is restricted to that particular part only. It is not entering into the body. It is not causing any infections into the body organs. So that is called as superficial infections caused by fungus. And deep seated infections, they are otherwise called as systemic infections. These superficial infections are they are very common, and various types of Tinya or ringworm. So they cause infections of skin, hair, and nails. So we have hairs, skin, and nails. So these tinea and ringworm infections are very commonly seen in hairs, nail, and skin. So they are very mild, always they are mild, but they run for a long period of time. Chronic diseases they are. And fungi, they causing superficial infections. They are specialized saprophytes. Saprophytes in the sense their mode of nutrition is dead and decaying materials. They depend on dead and decaying materials. So that fungi which are depending on dead and decaying materials, they are the causative fungi for the superficial infections or superficial mycoses. They have a capacity to digest the keratin. Hairs and nails, they have a keratin material. So because of that, they are brittle, they are hard. So these fungi, they have the capacity to digest the keratin also. In the sense, they release some kind of enzymes. So that enzymes will cause a dissolution of keratin material. Means they can digest the keratin material of hairs and nails. And then systemic mucoses, they are caused by fungi which are mostly soil saprophytes. So they are present in the soil. Generally, they are present in the soil. They are also saprophytes only. They are depending on the dead and decaying material of the soil. So infection is always accidental whenever we meet with the accidents, or whenever we meet with the injuries, or when we handle such a soil
or some dead and decaying materials. So accidentally the fungus will attack onto our body and it starts causing infection. Systemic mucoses, they are varying in degrees. So severity may be varying, ranging from asymptomatic infections. There may not be any symptoms, but you can see that infection. But sometimes there will be very serious symptoms also. So it may vary. Infection is accidental, and the systemic mucosis, it may vary from asymptomatic to serious condition. So, third type of fungus infection is opportunistic infection. Opportunistic infection. Usually, what happens? Non-viral means there will not be any disease-causing capacity to the fungus. But what happens in human beings because of some conditions, medical conditions, the immune power of the patient goes down. Because of that compromised immune state of a person, these fungi, which are avirulent, means they don't have any capacity to cause the infection, they are not that harmful, they start causing some infections. Such infections are called as opportunistic infections. So this is the third kind. So what we have discussed already, so superficial mycosis, deep-seated mycosis, and third one is opportunistic infections caused by fungus. So example of patients are patients who are suffering from AIDS. You all know immunity will be compromised, and the people who are suffering from cancer, diabetes, so who are using immunosuppressive drugs such as steroids and X-rays, who are exposing to X-ray radiations, and who are using broad spectrum antibiotics continuously for long period of time. Such a people, they suffer from immune compromised state. So that immunity compromised state makes them prone to suffer from fungal infections. So that kind of a fungal infection is known as opportunistic infection. So examples of fungus which may act as a opportunistic infection, they are mucor, penicillium, aspergillus. So they all can cause infection among human beings. Actually they don't have any virulence, means they don't have capacity to cause an infection. Because of the compromised state of immune system in the human beings, they start acting as a pathogenic fungi. So that is a third category of infections. First one is superficial mucoses, that is superficial fungal infection. Second one is deep seated or otherwise systemic fungal infection, and third one is opportunistic infection. So next let us discuss about superficial mycosis. It is mentioned in your syllabus as fungi, superficial and deep mycosis. So superficial mycosis means infections caused by fungi, that is mycosis. Superficial means so they are causing infections on the surface of the skin. So mainly surface infections and cutaneous infections. There are two types in this surface mucosis. So they cause infections on the surface of the body, that is on skin. So they are called as superficial mycosis. So second category, that is deep mycosis. Deep seated mycosis means the infection of fungi that enters into the body organs, that is called as deep mycosis. So here we are discussing about superficial mycosis first. So this superficial mycosis, again they are classified into two types, that is surface infections and cutaneous infections. So surface infections means they are exclusively on the dead layer of the skin. You all know that there will be a skin dying every day, so there will be a peeling off of the dead tissues on the skin. So on that dead layer of a skin, the infection exists, that is known as surface infection. So dead layer of the skin and its appendages, the infection is existing, that is known as surface infection. So they have no contact with the living tissues, and there will not be any inflammatory response. So these fungi, they are causing infection on the dead layer of the skin and its appendages, and it will not cause any inflammatory response. So there will not be any problem. So the only problem will be with the cosmetic appearance. So it looks ugly. So there will be some white patches or some discoloration. So it causes some damage to the cosmetic, just beauty, appearance. So that is surface infection. Tinya versicolor, Tinya nigra, and Pedra, they fall into this group. Means Tinya vesicular, Tinya nigra, Pedra. So these are the three kinds of fungi which cause surface infections. That comes in superficial mycosis. So the most important cutaneous infection is dermatophytosis. So dermatophytosis is a cutaneous infection. Cutaneous infection is the second type of superficial mycosis. First one is surface infection, second one is cutaneous infection. So this dermatophytosis is a type of cutaneous infection. So it is caused by some of the group of related fungi. They are called as dermatophytes. So the group of related fungi which cause dermatophytosis, they are known as dermatophytes. So infection is generally confined to the cornified layer of the skin and its appendages. So cornified layer of the skin and its appendages, so these dermatophytes cause a infection. So that leads to a inflammatory and allergic responses. So super surface infections, they are existing on the dead layer of the skin, so there may not be any inflammatory response and allergic responses. But cutaneous, so that enters into the skin. So cornified layer of the skin and appendages, it causes infection. So there will be a variety of inflammatory responses and allergic responses seen in the cutaneous infections. So in the person who is getting a fungal infection into the cutaneous, that is cornified layer of the skin, they exhibit allergic responses and inflammatory responses. So another type of cutaneous infection which is caused by Candida albicans is mostly confined to the skin and mucosal layer of the body. So it can also cause a systemic disease actually, as Candida albicans most commonly causes infection of the skin and mucosal layer, and also it can cause a systemic infection. That is why it represents a bridge connecting a superficial and a deep mycosis, because very rarely Candida albicans also can cause a systemic infection. Candida infection may be deep seated, means a systemic infection it may also cause. So that's why it acts as a bridge connecting a superficial and deep mycosis. So next let us discuss about some of the fungal infections which come under superficial mycosis. So one of the example here is Pitariasis versicolor. So it is caused by Tinya versicolor. So is a chronic asymptomatic infection which involves stratum corneum layer of the skin. It is characterized by a discrete confluent macular areas of discoloration or depigmentation of the skin. The areas involved mainly they are chest and abdomen and upper limbs and back. Chest, back, abdomen and upper limbs. So they are involved. There will be a depigmentation, discoloration. So the causative agent is lipophilic. It loves lipids. It is yeast like fungus, Pitarosporum orbiculaire is a yeast like fungus. So this disease is worldwide, everywhere it is distributed. particularly prevalent in the tropical areas, and it occurs mainly among adults, young adults, and diagnosis can be made by examining the scrapings of the skin. So there will be some dead tissues which are scraped out, and the layers of the skin, they are observed in the microscope. So yeast like cells can be seen, branched filaments, they can be seen through the microscope. The fungus can be grown on subards agar. So this fungus may be demonstrated on the normal skin also, and the disease is maybe due to compromised immune state, occurs as a opportunistic infection. So this fungus, Pitarosporum orbiculare, is found on the normal skin. So but it starts acting as a pathogenic fungus only when the people's immunity gets compromised. That is why it occurs as a opportunistic infection, Pitariasis versicolor. So there will be a depigmented, discolorated skin patches. So on chest, abdomen, back, upper limbs, so you can find this. So that is known as Pitariasis versicolor, which comes in superficial mycosis. So another example for superficial mycosis, that is fungal infections, is dermatophytosis. So dermatophytes, they are the group of closely related filamentous fungi. They are so that infect the superficial keratinized tissues of the skin, hair, and nails. They cause infections in skin, hair, and nails. They cause a variety of clinical conditions which are collectively known as dermatophytosis. So, clinically related conditions, they are called as dermatophytosis, popularly called Tinya or ringworm. So, what we use the term Tinya or ringworm, that is because of dermatophytosis. That is nothing but dermatophytosis. The term dermatomycosis, it is sometimes used as a synonym. So it includes skin lesions produced by the fungal infection such as Candida albicans also, and cutaneous manifestations of other systemic mycosis. So the commonly used term is dermatomycosis. So dermatophytes, they have been classified into three genera: Trichophyton, Microsporum, and Epidermophyton. So around 40 species of dermatophytes are known which cause infection among human beings and other animals. So lesions produced by dermatophytosis, so these appear as a hyphae. So dermatophytes, they appear as a hyphae in lesions and arthrospores. In cultures on subarords agar, they form a characteristic colonies consisting of septate hyphae and two types of asexual spores. So microconidia and macroconidia. They are the two types of asexual spores produced by dermatophytosis. So sexual spores of some species, they are being identified recently, and differentiation into three genera actually. So it is based on mainly on the nature of macroconidia. So two more examples of superficial mycosis, they are Tinya nigra. It is actually a localized infection of the stratum corneum, particularly of the palms, producing black and brownish macular lesions. So this infection is seen in palms, and there will be a black and brownish macular lesions will be there, and it is found mainly in the tropical areas, and it is caused by a Cladosporium wernicki. So this, if you take the scrapings from the skin, you can see brownish branched septate hyphae, and budding cells in the microscope. So colonies can be formed in a subaerodes medium. So they are gray and black in color. So that is about Tinya nigra. And another infection caused by fungi which comes under superficial mycosis is Pedra. So it is a fungal infection of the hair actually. So there will be appearance of the firm irregular nodules along the shaft of the hair. So they appear like a knots. So that is the collection of hyphae of the fungi. So nodules are composed of fungal elements. So they are cemented together on the hair, and two varieties of Pedra are recognized actually: black Pedra, which is caused by Pedria horte, and white Pedra, which is caused by Trichosporum beigeli.